Hello.
The topic that will be presented in the upcoming slideshow will explore the topic of
alcohol use amongst rural Indigenous Victorians. This presentation was put together by Sana, Stephanie, Adeline, Laura and Sam.
Alrighty, so let's get to the presentation. In 2008, around 1 in 6 Aboriginal and Torres Strait Islander people aged 15 years and over drank regularly at harmful levels, which consequently places them at substantially increased risk of chronic ill health and premature death. Indeed, alcohol abuse is a highly concerning chronic condition amongst the Indigenous communities. Now let's talk about lifestyle. Indigenous Australians living in rural Australia are exposed to isolation, resulting in lower levels of education, health, housing, employment and access to services. Stress associated to these lifestyle factors contribute to an increased risk-taking attitude towards health, increasing behaviours such as alcohol consumption. In turn, this creates an alcohol-promoting environment, thereby increasing its norm among the Indigenous population. Now think about this. There is a strong sense of well-being associated with having positive relationships with friends, family and the community as a whole, through access of services and support facilities. Now, negatively speaking, being associated with a low socio-economic status population, an increased number of health risk factors arise, thereby increasing people's likelihood of a lowered health status.
Adversely, alcohol abuse amongst such a population develops through a complex interweb of influences, compromising social pressures and norms, values and beliefs, as well as the poor access to healthcare facilities, which all stem from the low socio-economic status of the area.
So we're highlighting that low socio-economic status can have a detrimental impact on the overall health and well-being of communities. Each community within a rural area have unique characteristics reflective of its history, population, demographic, size, composition, and economic and social infrastructure. Many of these communities have been affected by drought, flood, fire, or salinity, and indeed, stress and distress associated by these ecological threats are greatly influential in producing mental health problems, such as depression, which then may influence one to turn to alcoholism.
In many rural and remote communities, there exists a culture of self-reliance, and that doesn't help to promote help-seeking behaviours for social and emotional problems. Instead, this common mindset often leads to risk-taking activities such as alcoholism.
Let's talk about stereotypes and discrimination. Another aspect that needs to be considered is the economical, social and historical conditions that may influence the health status of an Indigenous Australian. With the added attention of the media, Indigenous people are often portrayed in a negative light through stigma, discrimination and stereotypes when it comes to alcohol. A common stereotype that many people believe is that Indigenous Australians drink more excessively than non-Indigenous people. However, in reality, statistics reveal that Indigenous people are more probable not to drink compared to non-Indigenous Australians. Most notably, 23% of Indigenous Australians do not consume alcohol compared to 17% non-Indigenous Australians. It must also be noted that excessive alcohol consumption amongst Indigenous people can be a major behavioural risk factor, and they are more likely to drink at a high risk level of 1.5 times more than non-Indigenous people. That is, they may be involved in self-harm or physically violent situations such as within the family or the community. Nonetheless, it is expected that the Indigenous rural population have a life expectancy that is 12 to 15 years lower than the regional population. It must also be noted that historically, the Indigenous population were forced to endure removal of their historical disposition after the arrival of the British, and as a result, alcohol became a panacea for the Indigenous people's pain, and with many using it as a means of escape and solace. Let's discuss social determinants. Due to the remoteness and isolated nature of rural areas within Victoria, rural Indigenous Australians are more susceptible to having poor social and emotional well-being, thus increasing their likelihood of being exposed to behavioural and environmental risk factors.
So it's environmental factors that the Indigenous Australians are particularly influenced by. Specifically, we're talking about the social context in which they live, which ultimately serve to increase their vulnerability to alcohol abuse. Moreover, another social determinant influential to the increased likelihood of alcohol abuse amongst the rural population is the fact that there exists limited access to educational opportunities. And indeed, the lack of education then proceeds to influence their lack of employment opportunities.
And of course, the root to all these disadvantages is the issue of financial insecurity. Of course, one can truly understand the likelihood of the recurring or cyclic nature of alcohol abuse in such far from ideal areas that lacks the necessary means to promote a healthy and supportive environment. Consequently, with more barriers than opportunities, the rural Indigenous population are drawn to consume higher levels of alcohol and are less likely to be given access to healthcare services due to the inaccessibility and the inequity of healthcare.
Another existing issue is a lack of funding for rural Indigenous people. Now, this is incredibly important as these people need the medical and education support in order to overcome the social problem of alcohol abuse. There is an alarming high rate of morbidity and mortality amongst this population, influenced by alcohol abuse.
Having discussed the barriers, allow me to explore the components that may be essential in providing the opportunity to overcome such a problem. The provision and access to basic medical healthcare services are limited. So of course, we need to promote and facilitate programs that serve to educate and inform those associated with alcohol abuse and ensure that programs are non-judgmental, informative, culturally aware, engaging, and of course affordable and accessible to all those living in rural Victoria. So, what about an action plan or a program? Has anything actually been implemented?
Well, there are many action plans that have been developed by various health organisations in Australia, all with the intention of helping different Aboriginal communities improve their overall health lifestyle.
An example is the Koori Alcohol Action Plan, which is a 10-year strategy that has been set in place since 2010 by the Victorian Aboriginal Community Controlled Health Organisation, VACCHO, to reduce alcohol-related harms in Aboriginal communities in Victoria. The term Koori is a word that Aboriginal people use to describe themselves, and that is where the name of the action plan comes from. There are 4 priority areas in the Koori Alcohol Action Plan. They are strengthening communities,
responsible access to alcohol,
improved information and understanding,
and improved responses and services.
The outcomes of this plan has worked to gradually implement long-term changes regarding alcohol abuse within the rural Indigenous communities within Victoria. Ultimately, such a program serves to reduce the prevalence of alcohol-related issues regarding alcohol misuse. These are the references.